Hey everyone, Samantha here to give you another Atlas Wellness webinar. And this week we'll be talking about my very favorite micronutrient, vitamin D. So we'll start out by looking at what it is and what it does, and then we'll go a little more in depth to look at a few specific topics that I've at least heard get a lot of buzz lately. So looking at vitamin D and COVID, sun protection, and supplements. So vitamin D is a fat-soluble vitamin, which basically just means it's absorbed and stored with fat. And we can get it from some foods. It's naturally occurring in just a few foods, but it's also been added to some others, or we can also take it as a supplement. And it's also made by the body when the skin is exposed to ultraviolet light from the sun. And vitamin D does a ton of different things in the body. It actually works a lot more like a hormone than a traditional vitamin because it has a lot of receptors throughout the body in a bunch of different places, so it can interact with all those and cause a bunch of different reactions. So for one, vitamin D helps with the absorption of calcium, and both calcium and vitamin D are needed for strong bones and for teeth. And vitamin D deficiency can cause bones to be brittle or misshapen, so we need to make sure we're getting enough in kids so that they have healthy growth, and in adults for preventing osteoporosis. Vitamin D is also important in helping your muscles and nerves work properly, so this is again likely tied to that relationship with calcium, which plays important roles in muscle contraction and nerve signaling. Vitamin D is also really important for the immune system. So research is continually finding more and more effects of vitamin D in different disease states. So for example, vitamin D is believed to play a role in regulating cell growth and tumor growth, so may be important in preventing certain cancers. It also may play a role in other diseases like heart disease, diabetes, and some autoimmune disorders. So as far as COVID goes, because I know I've at least been hearing a lot of buzz in the media lately about the potential effects of vitamin D in preventing coronavirus, there have been some studies that show a positive benefit of taking vitamin D, and those studies traditionally are looking at doses of about 2,000 IUs, which we'll talk more about this later, but generally this is accepted as a safe and effective dose. However, there isn't enough evidence to actually definitively recommend using vitamin D as a prevention method for COVID. So it's important that you're getting enough vitamin D, coronavirus or not, but it's not in and of itself an effective prevention method. So just something to keep in mind. So how much vitamin D do you need? Well, this is actually a really controversial topic right now in the medical and nutritional communities. There is a lot of debate over the optimal levels of the active vitamin D in the blood that we need to prevent deficiency versus what appears to be the most beneficial for optimal bone and overall health. So the current recommendations for adults are 600 IUs or international units, and for older adults it's slightly higher at 800 IUs. Again, for those osteoporosis prevention benefits. However, there are some considerations in that these recommendations aren't intended for everybody. It's just to serve as kind of a general guidance for the average person. So, for example, these recommendations are based on the premise of minimal sun exposure, which we'll talk about on the next slide, since this is a really important consideration for us Washingtonians. And these recommendations also don't account for individual variation. So some people have a genetic propensity for vitamin D deficiency. People with darker skin also don't create as much vitamin D from the sun because their skin has more of a pigment called melanin, which can interfere with the reaction. People in larger bodies also require more vitamin D, and so they might need more to reach those adequate levels throughout the whole body. So to answer the question, how much do you need? It depends. There's a lot of different factors that might increase your needs, but in general, following that standard guideline is a good place to start. You just might need a little more. So the best way to know for sure is to actually get a blood test taken, and if you're deficient, ask your primary care provider about a recommended prescription dose. Otherwise, you can always ask your primary care provider or myself for a more individualized recommendation. But the good news is that toxicity for vitamin D is actually quite rare and the dose is quite high at 10,000 to 40,000 IUs. And this mainly applies to supplements. It's actually really rare to get that much vitamin D from food, and excessive sun exposure doesn't appear to result in any toxicity because our body has its own control systems in place. Now, of course, this isn't to say go ahead and go right up to the max, but this does give you a little more wiggle room to try to find that optimal level. And one of those factors that impacts vitamin D needs is sunlight exposure. So let's look a little more at this. And again, when the UV light from the sun hits the skin, it causes the formation of vitamin D in the body. However, the amount of vitamin D created through this process does depend on both the quantity and the quality of sunlight. So there are a lot of different factors that impact this. One is latitude. Northern latitudes, like us here in Washington, we get a lot less UV exposure. Interestingly, even if it is a sunny day here in winter, given our latitude, the UV light still won't be enough to make enough vitamin D. Season's also important. So again, winter, there's less sun versus right now in summer, we've got plenty. Time of day, so that 10 a.m. to 2 p.m. window is where the sun and UV exposure is really at its peak, which is good for vitamin D, but not so good for skin health, which we'll talk about in a minute. Length of day, so how much total sun exposure you can get. Cloud cover and smog make it more difficult for UV light to get through. Again, skin, darker skin tones producing less vitamin D. And then finally, sun protection. So sunscreen, clothing, all of this can serve as physical barriers to block the UV light on the skin. So this is really important for our skin health. Even though UV exposure is important for vitamin D, it's actually quite harmful for our skin. So it's a carcinogen, meaning it can cause cancer, specifically skin cancer. And additionally, the cumulative effects of UV damage to the skin over time can cause dryness and skin aging, which is really distressful to a lot of people. So try to limit your time in the direct sun, use sun protection, and don't use the sun as your main source of vitamin D. There are plenty of other ways that are a lot safer to make sure that you're getting enough vitamin D. And one of those ways is through the diet. It's not super abundant in a lot of foods, but we do see it in some. So here are some ideas. A lot of them are the fatty fishes. Might only take 3 ounces of fish, which is about the size of a deck of cards, to meet your daily needs for things like trout or salmon. There are, mushrooms. There's some other canned fish are great alternatives. Fortified foods, so milk and milk alternatives, dairy, they've all had vitamin D added to them. And since vitamin D is not particularly abundant in our foods and we should be limiting our sun exposure, some people may benefit from using supplements. In particular, supplementation is recommended for older adults, winter months, especially here in Washington, again because of the latitude we're at. For vegans, they might not be eating seafood or fortified dairy products, and folks with certain health conditions like kidney disease, fat malabsorption, or on certain medications that might impact needs. So if you choose to take a supplement, it's important to make sure that you're taking something that is both safe and actually works. So the first thing to consider is dose. Remember, the recommended dose for adults is at least 600 IUs, and for older adults is 800. And most multivitamins actually have this dose in them, but you'll notice that the individual vitamin D supplements tend to come in higher doses, usually ranging from 1,000 to 5,000 IUs. I'd recommend choosing something on the lower end at 1,000 or 2,000 IUs, unless otherwise prescribed by your doctor. If you have a higher dose supplement on hand, you can also take it just every few days. Since vitamin D is fat soluble and it's stored in the body, you can get away with just taking it once every day once every few days or so. The next thing to consider is brand. So contrary to popular belief, supplements are actually not regulated by the FDA. So a given product won't necessarily be safe or effective. So look for brands that have third-party testing. You'll see labels like the NSF, USP, or Consumer Lab shown here. And if you ever have a question whether a certain supplement you're taking or interested in taking is right for you, you can always just send it to me, and I'd be happy to look it over for you. And the final consideration with supplements is how you take them. So since vitamin D is fat soluble, it's important that you take it with a food or drink that has some amount of fat in it so that you can absorb it. So what I'd recommend doing is just trying to make a habit out of taking it at meals if you can. And that's all for today, but if you want to talk more about your individual micronutrient needs, you can always feel free to reach out. I can help you identify certain areas of possible deficiencies or provide guidance on how to address them, or even if you just want help talking about supplements, seeing if they're legit and safe. Whatever you need, feel free to reach out. Here's our email and our phone number and our texting number. Thank you.